أشهد أن لا إله إلا الله. أشهد أن لا إله إلا أشهد أن محمدًا رسول الله. أشهد أن محمدًا رسول حي على الصلاة. حي على الفلاح. حي على الفلاح. الله أكبر الله أكبر. لا إله إلا الله.
اللهم رب هذه الدعوة التامة والصلاة القائمة آت سيدنا محمدا الوسيلة والفضيلة والدرجة الرفيعة وابعثه مقاما محمودا الذي وعدته وارزقنا شفاعته يوم القيامة إنك لا تخلف الميعاد.
ऐ अल्लाह, इस दावत कामिल और ता क़यामत कायम होने वाली नमाज के रब, तू मोहम्मद सल्लल्लाहु अलैहि वसल्लम को जन्नत में नुमाया मकाम, फजीलत और बुलंद दर्जा अता फरमा और उन्हें उस मकाम महमूद पर फाइज फरमा जिसका तूने उनसे वादा फरमाया है, और क़यामत के दिन हमें उनकी शिफात नसीब फरमा। बेशक तू वादे के खिलाफ नहीं फरमाता।
जो शख्स बेटी के पैदा होने पर खुशी करे तो वो खुशी करना 70 बार खाना काबा की ज़ियारत करने से अफजल है।
एक बदर एक्सपो की तरफ से जो है एक अच्छा हमें प्लेटफॉर्म मिला हुआ है IEEE फेयर का, जिसके अंदर हम लोग अपने डिफरेंट प्रोडक्ट्स को जो है शोकेस करते हैं।
बदर एक्सपो ने हमें एक प्लेटफॉर्म दिया, वो हमें काफ़ी सपोर्ट भी करती है और यहाँ पे डिफरेंट कंपनीज को भी उसने काफ़ी सपोर्ट किया है।
I'd like to thank the dignitaries and all the guests, the sponsors, the exhibitors who have been with us through the years and have made this event possible.
It is a great opportunity for the investors and even the dealers and the distributors to participate and engage in this seminar, and I further request the management of Badar Expo to continue these seminars for the general awareness of the people.
बदर एक्सपो की तरफ से जो है एक अच्छा हमें प्लेटफॉर्म मिला हुआ है IEEE फेयर का, जिसके अंदर हम लोग अपने डिफरेंट प्रोडक्ट्स को जो है शोकेस करते हैं।
बदर एक्सपो ने हमें एक प्लेटफॉर्म दिया, वो हमें काफ़ी सपोर्ट भी करती है और यहाँ पे डिफरेंट कंपनीज को भी उसने काफ़ी सपोर्ट किया है।
thank the dignitaries and all the guests, the sponsors, the exhibitors who have been with us through the years and have made this event possible.
It is a great opportunity for the investors and even the dealers and the distributors to participate and engage in this seminar, and I further request the management of Badar Expo to continue these seminars for the general awareness of the people.
It's 1 p.m.
I would like to call Dr. Somia Iqtidar. She is a physician by specialty, a faculty at the King Edward Medical University and Mayo Hospital, General Secretary of the Pakistan Society of Internal Medicine with contribution to multiple public health projects in Punjab and across the country. Welcome, Dr. Somia. Then I want to call upon Dr. Asif Imam. He is an immunologist and internist by specialty. He is a consultant at the Aga Khan University and South City Hospital. He is the founder and chairperson board of trustees of the Sina Health and Education Foundation. Welcome, Dr. Asif. Next, I would like to call upon Mr. Javed Ali Jagrani. He is an officer of the Pakistan Administrative Services, currently leading and transforming the People's Primary Healthcare Initiative in Sindh as its CEO. If Professor Javed Akram is here, sir, Assalamu alaikum. We'd like to invite Professor Javed Akram to please join us on stage. Sir, last week. He is Vice Chancellor of the University of Health Sciences, the President of Pakistan Society of Internal Medicine. He has served as the caretaker Health Minister of Punjab, and he's a former VC of ZEBMU and has over 40 years of experience in the health system of Pakistan. I welcome all our esteemed panelists to this session, a very key session and the first session of this Health Expo on the global primary health care and the universal health coverage and where we stand. Pakistan is committed to achieve the Sustainable Development Goals by 2030. And today in July 2025, it is a critical moment to discuss the SDG 3, which is the health goal of achieving universal health coverage through primary health care. The theme of this conference, the Global Collaborations for Better Health, reflects the SDG 17, which is the goal of multi-stakeholder partnership. With this preamble, I would like to request Professor Javed Akram Saab. Sir, from your vast experience of academics and the health system, please enlighten us on the lacunae and the bottlenecks in the two key areas, the health policy and the curriculum. The National Health Vision 2025, what it was able to achieve, the upcoming National Health and Population Policy, how it will help us achieve the SDGs, and the impact of devolution, especially in the context of the curricular reforms required for bridging the HR that can support us in establishing the universal health coverage.
एक ही पॉलिसी को आगे इम्प्लीमेंट करे, बजाय इसके कोई नई पॉलिसी बनाए, पहले अंडू करे। तो मैंने उन्हें कहा कि जी आपने ही ये ऑल पार्टीज कॉन्फ्रेंस कराई थी टेररिज्म की, और तब उसके खातिर खा रिजल्ट आए थे। अब आप ही ये मीटिंग बुलाएं तो वो हंसने लग पड़ेगा, ये तो हमारा काम ही नहीं है। मैंने कहा जी काम तो आपका है या नहीं है, लेकिन आप ही कर सकते हैं कि ऑल स्टेक होल्डर्स, ऑल पार्टीज, ऑपोजिशन, गवर्नमेंट, everybody, army themselves, because they are in government also, so we should all agree to a health policy, irrespective, और 50 साल की health policy दे दें कि जो आए अपना हिस्सा डाले, उसमें change ना करे। So that is the only way I think that Pakistan should go.
Thank you, Dr. Javed. In the interest of time, I have to cut you a little short. So wonderful points by Dr. Javed Akram, that policy is really not the problem. It is mostly the issue of implementation, and short-lived policies do not work. They should be long-term policies which should be applied across the country by all politicians and all governance that come in. Next, I would like to request Dr. Khalid Shafi Saab. You have been spearheading many public health initiatives on your platform of the PPA, and especially in the childhood immunization category, and as the chair of the NITAC. So what are some of the main health and social issues that are causing these not so good indicators in child health, and how our current immunization program and the upcoming vaccines can achieve universal immunization coverage? And one key question is, what is your expectation as chair of NITAG? I would like to ask you, what is your expectation for polio and measles eradication in Pakistan? This is a very key thing.
Thank you. You have asked three things each of which needs special attention and answer. First is the health indicators. Regarding the health indicator, although there is some improvement in the health indicators, our physical age has now in the 60s, it was in the 50. Our infant mortality rate was 126, now it is in the range of 67 and 80. Lekin, in spite of this, the rate of progress is not proportionate to the efforts. First of all, the efforts are only done in the curative side. Our health policy, health budget is mainly directive towards the curative side. Look at the budget of the same in this year. Out of 350 billion approximate budget, only 16 billion is allocated to PPHI. This approximate figure, which covers 70% of the primary health care of the Sindh. And only one hospital, SIUT is given 18 billion, Indus is given 10 billion, a new hospital is built with 10 billion Larkana, and there is so much distribution of the funds all around. But for the primary health care, which is the basis of the health foundation, is so much neglected. Number one part is that. So, Dr. Javed Akram has rightly said that the government and the leaders are only interested in achieving the things. Today, if you immunize a child, the benefits will be evident over the next 20, 30, 40 years. If you counsel a mother about the breastfeeding, the result will come later. But if you make a heart transplant, kidney transplant, it will be very attractive to the people. One thing is that. So our health indicators are not improving as they should be. There was a plane crash with the PIA 2-3 years back. Now the people still remember. There is a plane crash of the Air Blue and other airlines, people remember. But daily, equal to 2 jumbo jet passengers number, children are dying in Pakistan. But attention is not being given to that. We have prepared a costed action plan for the newborn survival. Government has, Dr. Javed has rightly explained everything. We worked 2 years for making a strategy for improving our newborn mortality, which is the worst in the world. But the costed action plan is there, but it is not being implemented. Still, the government main focus is on the curative medicine, which gives early results. But this primary healthcare foundation will give later results in a long run. So this is a neglected part. This was your first question. And the second question was, remind me, that was about the immunization. Okay, the main issues which call, number one is the lack of the civic infrastructure. For example, I give you an example. When this rotavirus vaccine was introduced in the EPI program, we were very hopeful that now the hospital will not be treating so many patients with the diarrhea. But still, our lack of infrastructure, good hygiene, sanitation, safe water, it is not being complemented with that. In the Western world, they have achieved attention on the health issues plus improvement in the civic infrastructure and the hygiene and the safe water sector. This is a total ignored part. Our first priority should be to provide the safe, clean drinking water to our people. There is no plan for that at all. Even the water is not there sufficient. So one factor is that. Other factors that I have just explained, that we are curative minded, not preventive minded. Second factor is from the other side, that is the demand. That is demand. There's so many good programs are there, but the people are not availing them because of the, number one, poor literacy rate, lack of awareness, and lack of the sense of the health education. For example, vaccine program is there. The government purchases vaccine for every newborn who is born in Pakistan, but the utilization is less than 70%. There are other factors for that. Our misbeliefs is still, we have so many misbeliefs that of the people, we go door to door for the eradication of the polio, but the people refuse for that. So one thing is that, now coming to that, what is our expectation about the polio program, polio eradication, the measles elimination? Regarding the, if we take it the program as a polio control program, this is a very successful program because there are very few cases of polio. But for the eradication, which is an absolute process, we have to go far beyond this. So much energies and so much funds are being allocated to polio program. Even the Prime Minister, Chief Secretary, everybody is committed. The Commissioner, Deputy Commissioner, Assistant Commissioner, Police Force, everybody is supporting to this program. But because of the misbelief of few thousand parents, still the virus is circulating. But still, we have no option. We have to eradicate the polio because the whole world is looking after us. And we have not this option that we can ignore this. It's about the polio. Second is the measles. Measles is a killer disease. We, the pediatricians, know very well this is the worst of all the vaccine preventable diseases because it has significant incidence. Unfortunately, it can be easily prevented just with 2 doses of the vaccine. First dose is given MR vaccine at 9 months, second at 15 months. But our coverage, which is start in the range of 80-85% at birth, drops to less than 70% by the 9 months of age. And this figure is complemented by the high vaccine coverage rate in the Punjab and Azad Jammu Kashmir. If we come to Sindh, it is 69%. If we go to KPK, it is 60%. And if we go to Balochistan, it is 29% coverage only. So, but the situation is so disheartening on one side. On the other side, it is not that we, the health provider or the public health specialist, we have not given up. We are still raising our voices, and whatever places at the policy level we are working, we are trying best to overcome this situation. I give you just this example regarding the NITAC. NITAC is not an executive body. It is a group which is formed by the government of Pakistan to give the policy guidelines regarding the immunization to the EPI and the Ministry of Health. Regarding in my tenure, in the last 2 years, as a chair, what we have achieved, number one, on the top of that, we have included human papilloma cervical cancer vaccine in our EPI program. This is a great gift to the female children of Pakistan. Every year, 5,000 women who are suffering from the cervical cancer die because of that. We will be saving their lives. This is a great achievement, and this HPV will be rolled out in the Punjab, Sindh, AGK, federal area on the 15th September. Every female girl from 9 years to 14 years of age will be given this vaccine, and from the 1st January 2026, it will be included in the National EPI program. In the start of the 2025, KPK and Balochistan also will have the similar campaign. This is one achievement we have done to overcoming the measles, this so much high rate of the incidence of the measles. There are many suggestions at an ad hoc process. we are going to have an SIA, special immunization activity in the November, where all over the Pakistan, we will be vaccinating the children from the 6 months to 5 years of age. So after this, we are working, the NITEC is working on the measles elimination strategy, and we are working that we will control the measles to such a level that it will not be a public health problem. Still, it is the major vaccine preventable disease. The cases are there, the hospitals are most of the time flooded with this. These two are the main achievements regarding the NITEC. The NITEC Pakistan has recommended, first of all, I will want to share with you, now the NITEC has the vision that the vaccine for all ages, which is called the life course vaccination. Till now, the vaccination program was limited to the children under 2 years of age and the pregnant ladies. But now the NITEC has given the vision that all the people of all the age deserve vaccination, whatever is required. In the first step, we have recommended that the vaccination coverage should be increased to the 5 years of age. As an ad hoc measure, the big catch-up company is there. It is being done in Pakistan. And hopefully, this recommendation of the NITEC will be accepted by ministry. And by the 2026 start, we will be having children who miss the doses till 5 years, they will be eligible. I have 1 minute now.
We can have 2 more minutes later on, then we can continue with that. Thank you so much, Dr. Khalid. Very interesting insight that one side, the budget is an issue, that it is not directed to the right area. And on the social side, the literacy and the demand issues, and then the problems with the civic infrastructure. And it was wonderful to know about NITEC and how we can expand these suggestions and incorporate them. The next, I would like to invite Dr. Somia Iqtidar, and I would wanted to ask you that Pakistan's current demography, it basically has a youth bulge and over 15 and towards the 60 years old. For any country, this is a demographic dividend, economically speaking. These people should be nice and healthy and contributing to our economic growth. However, in Pakistan, this age group is suffering from increasing prevalence of non-communicable diseases like diabetes and high blood pressure. And as they grow, they will not be able to contribute economically the way that any country can actually benefit from this. So what is your view about the preventive and gatekeeper role of primary healthcare as compared to the curative focus that we currently have in our country? And then how do you see that in this aging population, is the health system ready to cater to them? What do we need to do? Because when these people grow up with all these non-communicable diseases, there is a huge chunk of economic burden on the country. So I think you have a presentation. Please, can you help us start that? Thank you.
Okay. So thank you very much. Good afternoon, everyone. My name is Dr. Somia Iqtidar, and we are all aging. And it's one of the life's few guarantees that we will age with every passing day. But as communities live together, are we truly ready for what this means, aging-related issues? So today we'll try to cut noise, we'll talk real challenges, real solutions, and how primary healthcare must lead the charge for true universal health coverage. So let's get started. So let's talk about numbers, because they tell a critical story, right? So Pakistan has 16.5 million people aged more than 60 years. And that's nearly 7% of us. But look ahead. By 2050, that number rockets to 40 million. That's 12% of our population and almost double of today's reality. So there are 2 urgent details. Women, especially over 80, vastly outnumber the men. And it's not just that it is in the cities, it's hitting the rural communities hardest, where care is hardest to reach. And this isn't a future problem. It's unfolding right now, today, because in clinics, we see a lot of old age patients with multiple comorbidities, and not only in clinics, but in rural health centers as well. So, why is aging accelerating? This is the question, and this powerful trend tells us the story. So first, we are living longer. So life expectancy, it jumped from 60 years, which was in 1990, to over 70 today. But secondly, fertility rates are also different. From 6+ children per woman in 1990 to under 3 today. Fewer babies, but longer lives. And this is an aging tsunami. So by 2050, this curve shows a 40 million elders which will be waiting for care. And this isn't accidental. It's actually a demographic transformation. So these numbers aren't just stats. They are people, and our system is struggling to catch up with them. And let's have a reality check. Primary healthcare isn't built for seniors. When we talk about primary healthcare, it's usually mother and child healthcare or a younger population. No geriatric training, no tailored services. And over 60% of our older, we all know that they battle chronic diseases like diabetes, hypertension, ischemic heart disease, and increasing number of hepatitis and renal disease as well. So problems are emerging and increasing. And programs like if we talk about Punjab, Sehat Sahulat, they fall short. They skip outpatient care and home health, and that's exactly what elderly population needs. So the families are drowning, especially the women, and it's a system failure. And what's the solution? Prevention, which barely exists. So we are reacting and actually not preparing for the future. There are no dedicated geriatric care facility in the country. This was stated in 2023 by Pakistan Medical Association. And that is so true. Geriatric care isn't taught in the medical schools. There are no specialized clinics for complex elderly needs. There is no structured training for post-graduation in the geriatric care as well. So the gaps are straining our entire system. This leads to uncoordinated referral systems. Rising demand for chronic diseases management puts a burden because these are lifelong diseases and they need a long-term care. There are weak social protection and many seniors face poverty, illness, which is a dangerous mix. And there are no long-term care models available. We improvise daily, and obviously, if on a daily basis you are doing this, that's unsustainable. So it's a flying blind. Without age-specific data or digital tools, we are just guessing and not saving. So this isn't just insufficiency, it's real lives in the balance, and we need to do something about it. I'm just trying to show you here about the international medical graduates in specialities in the USA. This is just to give you an idea when we compare it with Pakistan. That 51.2%, that is for of the international medical graduates in US actually go to the geriatric medicine. This is more than all the subspecialties that they opt for their training. But the situation in Pakistan is completely opposite. There is just a handful of geriatric specialists for over 16.5 million elderly people. There are only 2 formal pathways which exist. One in AKU, which runs a fellowship program in geriatric medicine. And there is a CPSP-linked, Birmingham-linked program in UK where they provide training. So this is the progress, I would say, but it's a single drop in the ocean of need. We need every medical college training geriatric experts, and we need every district hiring them because the foundation is laid, and now we have to build on this by improving our systems. So how do we scale? With 4 non-negotiable pillars: education, clinical systems, policy, and research. If we invest in them, I think we can come up with something which can help us in the future. But we also need to know that UN has declared this is the decade for healthy and age-friendly environments, and that's our primary healthcare hubs and mobile units. So we have to combat ageism by training providers to value elders' dignity. We have to develop integrated care by linking clinics, homes, and social support. And we need to have a long-term care plan by piloting the community centers. So the Pakistan's action plans aren't optional, they are a global priority because UN also demands for this. So now let's build our plan to match the international standard. And we have to shift our focus on the health care instead of sick care. Unfortunately, we are treating patients and not preventing illnesses, which is the need of the hour. So prevention starts from the pre-geriatric care. So regular and moderate physical activity since childhood has to be encouraged. The nutrition services has to be improved. We have to tell our youngsters to abstain from smoking and alcohol and avoid self-medication. We have to engage them in healthy hobbies like reading, writing, sports, and listening to music. And in some countries, they have this financial security in adulthood itself program, which is an old age social and income security program with the name OSS. So we have to start in the pre-geriatric if we want to improve the care of our elderly. So the primary prevention starts with health education. We need to improve immunization. We have to work on screening of chronic health conditions like diabetes and hypertension. We have to improve our dental services as well because they are also very important, especially in the elderly population. Exercise program, nutritional interventions, and in females and men also sometimes hormone replacement therapy is the need of the hour. Coming on to the secondary prevention, we have to screen for diseases like diabetes by doing a mass community level screening programs because diabetes has become the #1 disease in the